Hello everyone, and welcome back to the second video in this video series talking about depression among cardiovascular disease patients. In this video series, number 2, we will focus more on nursing attitudes surrounding depression and being able to talk about it with our patients and feeling comfortable as a nurse um, discussing it and taking care of patients who have depression. So So as a nurse, you spend an average about 20 to 40 minutes per patient per day just on educating patients or their family members about their heart conditions. You also spend countless hours assessing and monitoring their progress towards discharge, whether that be reviewing vital signs, intake, output, um, management, and coordinating with case management. You are, I think, invested not just in their recovery while they're here in the hospital, but making sure that they're prepared even once they leave. I like to call it the nursing triple threat. Um, or it's the nursing care model where we focus on not just physical well-being but also emotional and spiritual well-being to get our patients set up for the most success possible. And if we spend so much time caring for and educating our patients in order to help them be successful, and we do not address components of mental illness that may be present, then we are failing them. Like we talked about in the last video segment, depression has impacts on a patient, such as decreased education retention, likelihood for plan of care adherence, medication adherence, as well as an increase in the short and long-term adverse events. And as a nurse, do you sometimes feel uncomfortable talking to your patients or their family members about mental health issues? In the end, you're not alone. In a lot of studies, nurses who are taking care of critically ill patients, up to 65% of them do not feel prepared to discuss mental health problems with patients and family members and to integrate or change their plan of care if mental health problems are present. Being prepared as a nurse to help these patients who have mental health problems, or such as depression, can mean different things to everyone. For some people, it's knowing more about depression in order to answer questions. For other, it's knowing how to approach a patient and a family member, or it's just having a general fear of the components of mental health, just not understanding it completely and not having, a personal understanding. Hopefully, some of the information that we're sharing in these video segments um, help you learn and understand more about depression and its impact on cardiovascular disease patients. From a nursing standpoint, we compose a huge part of the healthcare workforce. And if the data is correct that we looked at in the first portion of these videos, if you have a 5-person assignment, then there is a high probability that at least one, maybe even two of your 5 patients are suffering from symptoms of depression or from major depression, and you can do something about it. Looking more at impacts, within an acute care setting, you, the nurse, spend the greatest amount of time during the course of a day with the patient compared to all the rest of the members of the interdisciplinary team. The doctor, the pharmacist, social worker, everyone. You spend the most time with them. Depression is difficult to detect because all patients will present with a variety of psychological or somatic symptoms and may be reluctant to acknowledge symptoms of depression. But depression as a mental illness can be successfully treated, and treatment is more effective when it's started earlier and identified sooner. That's where depression screening comes in. For anyone who has worked in a primary care clinic, mental health, or women's health, depression screening does not sound like such a foreign thing. In essence, in the hospital, we have been screening for severe depression through our required admission suicide screening. But if you think about it, at that point, if patients are beginning to become suicidal and have those thoughts, should we not have had some sort of measure to catch this problem sooner? So, as nurses, we like to understand why, the why of things. And so, looking at screening for depression in cardiovascular disease patients, this is why it's effective. Depression is sufficiently common enough in this population to merit screening. There is a early phase or an asymptomatic phase of depression that can be detected by screening, in which the treatment plan becomes much more effective. There are a handful of acceptable screening tools that we'll discuss more in our next video. And some other concerns when thinking about implementing screening in an acute patient setting is talking about work considerations such as if this screening tool is easily administered, if it's inexpensive, and if it's tolerated well by the patient. So now that we've talked a little bit about the why and the impacts of nursing that you have in being able to help these patients, we look at what can you do um, as a nurse. Um, some examples to help your patients in these types of scenarios. Um, for example, altering your plan of care um, is the number one place to start. Things such as education overload must be addressed. This is recognizing that patients respond differently to plans of care. Um, we should try to involve family members as much as possible. We should try to limit verbal education sessions and try to utilize other means of education, such as online resources and paper handouts. And then the biggest part is lastly, it involves communication with members of the interdisciplinary team. This is to talk about what the concerns we have for our patient are, or communicating screening results with them in order to, as a team, address the impacts of depression that it may have on discharge education or ensuring that there is appropriate follow-up after the patient has gone home. I'd like to thank everyone for their time in this video. Now I have these two case studies for you to look at and to answer. Be sure to pause the video in order to read them and answer them correctly. And we will plan on seeing you for video number 3. Thank you.